Hey guys, welcome back. And today we are going to discuss other nursing diagnosis, that is knowledge deficit. So, knowledge deficit is a common nursing diagnosis for all the condition. So, whatever the things you are writing at last, we will write this also knowledge deficit, right? So, we are going to discuss how to create the nursing diagnosis and how to develop the nursing care plan for knowledge deficit. So here I'm giving the general nursing diagnosis and general nursing care plan. You can imply or you can apply this diagnosis and care plan in your specific condition. So your nursing diagnosis will start like this, okay? Knowledge deficit related to your condition, okay? Your condition, okay? As evidenced by symptom of your patient. For example, knowledge deficit related to controlling diabetes as evidenced by difficulty in monitoring blood glucose level. So the patient is having knowledge deficit because of what? He don't know how to monitor a blood glucose level. So he is having diabetes or she is having diabetes and she is having knowledge deficit related to how to monitor blood glucose level. Okay, so like this you have to write your nursing diagnosis. Knowledge deficit related to your patient condition. My patient condition is diabetes, so controlling diabetes as evidenced by symptoms of your patient. My patient symptom is difficulty in monitoring blood glucose level. Okay, so in this way you have to develop your nursing diagnosis. Knowledge deficit related to, okay, your patient condition as evidenced by symptom of your patient. Okay, now we are going to see the nursing care plan. In previous videos also, we have discussed the same thing. I'm repeating the same thing again. When writing your nursing care plan, you need these columns: assessment, diagnosis, planning, rational, implementation, and evaluation. Assessment, diagnosis, planning, rational, implementation, and evaluation. So under assessment, you have two things: subjective data and objective data. What is subjective data? What patient is saying about their condition, that is subjective data. What is objective data? What you are observing from the patient situation, that is objective data. So here what is subjective data? Patient said that she don't understand the instructions and how to follow the treatment, because that's what we are creating this nursing diagnosis, knowledge deficit. What is objective data? The patient looks anxious and confused. Obviously, the patient will show anxiety and will show bit of confusion because she or he doesn't know how to do, how to follow, how to monitor, how to continue the management modalities, or how to follow the treatment plans. Okay, so in subjective data, you can write about your patient's understanding. Okay, the same thing you can write always. She or he don't understand the instructions and how to follow the treatment. In objective data, the same thing again you can write. The patient looks anxious and confused. Then while coming to the diagnosis, the same thing you can copy. Knowledge deficit related to your patient's conditions as evidenced by your patient's symptoms. All right. Then you have to write a goal. Okay. The patient will demonstrate an improved understanding of the patient condition. Again, apply the knowledge to manage their condition effectively. Okay. So that is about goal. The patient will demonstrate an improved understanding of patient condition and apply knowledge to manage their condition effectively. Will. Okay, in future tense, you have to do. The patient will demonstrate an improved understanding of your patient condition and apply the knowledge. Okay, will apply the knowledge to manage their condition effectively. Then we can go to the planning. After planning, rational, then after rational, implementation. So always start with history collection and physical examination. Do history collection and physical examination. For what? What is a rational? To understand the present condition of the patient. What is implementation? Do history collection means obviously done history collection and assess the present status of the patient. Then next, provide information. That's very important because the patient is having knowledge deficit, or she or he has knowledge deficit, lack of knowledge about the specific process or specific treatment or specific condition. So provide proper information for what? To improve the level of understanding of the patient. That is the rational. Then in implementation, provided clear information, used simple understandable language, use some diagrams and videos. Whatever the things you have given to your patient to improve the understanding, that you have to add in the implementation column. Then ensure comprehension. That is the third planning. Okay, for what? To provide positive reinforcement reinforcement to the patient. Okay, in implementation you can write ensured by asking the patient to repeat the information in their own words. That's really useful to improve the knowledge of the patient. Not only for patient, guys, whenever you are, when your teacher is teaching, the teacher need to ensure by asking the student to repeat the information in their own words. Okay, that will make the thing more clear, right? So ensure the comprehension, that is the third planning. Then next thing is demonstrate, okay, or show new skills. For what? To improve the understanding of the patient, to improve the understanding or to perform specific task or procedure, to demonstrate or show new skills to the patient. For example, if the patient is having lack of awareness about insulin injection, okay, you can demonstrate, okay, you can show the patient how to do that thing. Then for what is the rationale? To perform specific task or procedure. Okay, in implementation, demonstrated new skills. For examples, like showed how to use insulin syringe and how to do deep breathing exercise, okay, etc. Whatever the things you have done, that you have to write in implementation column. Then next planning is provide opportunities for the patient to practice skills. For what? To improve the confidence and skills of the patient. In implementation, provided opportunities under the supervision. Then assess learning needs of the patient. That is the next planning. Okay. For what? What is the rationale? To address the needs of the patient. Again, implementation, identified and assessed the learning needs and given some ideas to improve the understanding. Then create a learning plan and set achievable milestones. That is the next planning. What is the rationale? To increase the knowledge of the patient. Okay, in when it comes to implementation, created a structured plan for education, including short sessions. The next planning is provide additional resources, okay, and encourage questions. Provide additional resources and encourage questions. For what? To give ongoing support for the patient. And what is implementation? Provided resources such as support groups, okay, websites or community services which is available. Okay, the patient who is admitted in the hospital, now that for that patient you cannot give community services. Okay, you can go for support groups and website. The patient is like a what, outpatient, okay, or coming for any therapies and kind of stuff, means you can give community services. Then evaluate the understanding. That's very important. For what? To do changes in the plan. And what is implementation? Evaluated the understanding through monitoring and follow up. Okay, so in implementation column you have to make it advanced, guys. In implementation column you have to write, okay, what all the plans you have implemented for the particular patient. Okay, simply don't write the past tense of your planning. If some students will write like that: evaluate understanding, evaluated understanding, provide additional resources, provided additional resources. Don't stop there, guys. Provided resources such as whatever the things that will improve the credibility of your writing. At the same time, that will enhance your knowledge, and also the evaluator also will get a good idea on your paper. Okay, and you gradually that will deepen your critical analysis skill. Okay, here I didn't add the evaluation column. You have to write the evaluation column this time. Okay, what is the evaluation? What evaluation you can write? Okay, your goal is the patient will demonstrate an improved understanding of the condition and apply the knowledge to manage their condition. So what would be the evaluation? The patient demonstrated an improved understanding of the condition and applied the knowledge and managed their condition effectively. Oh, and patients reduce their anxiety and tensions. Okay, like that you have to write the implementation. All right, guys. So this is the nursing diagnosis and care plan for knowledge deficit. Hope you understand, guys. Thank you.